Have you ever heard of Atorvastatin and Simvastatin, the famous medications used to lower cholesterol, and wondered, are they the same thing? Both promise to protect your heart, but there's an important difference between them, and knowing which one to use can make all the difference for your cardiovascular health. Stay with me until the end and I'll explain in simple terms which one is stronger, which tends to have more side effects, and in what situations doctors usually prescribe one or the other. Heart. Just a reminder, this content is for informational purposes only and does not replace medical or pharmaceutical advice. Both belong to the same class of drugs, the statins. They work by blocking a liver enzyme called HMG-CoA reductase, which is responsible for producing cholesterol. That helps reduce total cholesterol and the well-known LDL, the bad cholesterol. The difference starts with how each one acts and how powerful they are at lowering cholesterol. Potency and effectiveness. Atorvastatin is considered more potent than simvastatin. For example, 10 milligrams of atorvastatin can reduce LDL cholesterol by about 35 to 40%, while 20 milligrams of simvastatin reduces it by around 25 to 30%. That's why when a patient needs a stronger cholesterol reduction, doctors usually prefer atorvastatin. Duration and metabolism. Atorvastatin has a longer half-life, meaning it stays active in the body for longer, about 14 hours, so it can be taken at any time of the day. Simvastatin, on the other hand, has a shorter half-life, around 2 hours, so it's best taken at night when the liver produces most of its cholesterol. Drug interactions. Simvastatin is more likely to interact with other medications, especially some antifungals, antibiotics, and drugs used for blood pressure or as immunosuppressants. These interactions can increase the risk of a serious side effect called rhabdomyolysis, which causes severe muscle pain and kidney damage. Atorvastatin can also interact with other drugs, but to a lesser extent. Side effects. The side effects are similar for both: muscle pain, elevated liver enzymes, gastrointestinal discomfort. However, since simvastatin is more sensitive to interactions, the risk of muscle-related side effects is a bit higher in people who take many medications at once. Now that you know the difference between atorvastatin and simvastatin, tell me in the comments, do you or someone in your family take any of these medications? Have you ever experienced side effects? Write it down below. Your experience could help someone else. Don't forget to like the video, subscribe to the channel, and turn on the notification bell.